Welcome to the Wellness Revolution Podcast, the radio show all about wellness in your mind, body, spirit, personal growth, sex, and relationships. Stay tuned for weekly interviews featuring guests that have achieved physical, mental, and spiritual health in their lives. If you'd like to have access to our entire back catalog, visit drveronica.com for instant access. And here is your host, Dr. Veronica.
This is Dr. Veronica, and you're listening to Wellness for the Real World. And I'm a medical doctor and medical intuitive, and I love to tell you about all matters of health and wellness, and especially the topics that you never hear about in mainstream media. And now, how about that? This is considered mainstream media, but the mainstream that you don't hear about. You're going to love this particular segment. There's going to be half of you are going to cringe because you can't imagine anybody over 25 taking off their clothes. And the other half of you are going to say, finally, somebody's talking about these topics. So let me just give a plug. If you ever want to reach me, you have an idea about a show topic, you want to ask a health question, an intuitive question, you can get me on drveronica.com, drveronica.com. And follow me on Twitter, Dr. Veronica IMD. And on Facebook, I actually have a group that I love people to join, Body Metamorphosis. Look for Body Metamorphosis. It's a group where we talk about health and wellness. It's a private group. You got to ask to join. I want to keep it so that it's respectful and very high level, so that people there feel comfortable looking and sharing, and it's not just a melee free-for-all that happens on a lot of social media today. So Dr. Veronica Anderson is my general fan page, but Body Metamorphosis is my private Facebook group. Ask to join. I'd love to have you in. I also have here with me my co-host, Russell. You guys know him by now. Hi, Russell.
Oh, you're so nice. Hi, Dr. Veronica.
Now, this is going to be a lot of fun because we're going to talk about sex today, but sex in a different way. I get really fed up because the only type of sex that we see is kind of, bachelorette type stuff, or and then on the other side is, pornography. And then there's the rest of the world, especially the rest of the world that has passed 25. People who pass 40 and 50 and 60 and 70 who are still and have never stopped being sexual beings. Imagine that. Do you think that when you turn 25 in one day, you're going to stop being a sexual being? No. And in fact, especially for women, your sex life actually gets better and picks up. I think the older that you get, the more mature that you get. And there's a few. I'm gonna do another one of these shows, How to Be a Boy Toy Babe, because I got to tell you, when I first got divorced, all my boyfriends were like rather young, and some might say maybe not so age appropriate. And I've been blessed with a youthful appearance, so most people that look didn't think it was like a mother-son thing going on. But finally, I found a man who's youthful appearing and age appropriate. But you know what? He's got the body and the sex thing going on like a kid. So that's working really, really well, by the way. So I'm going to bring on our next guest, Joan Price. You want to know this lady. She does Naked at Our Age, and she's written The Ultimate Guide to Sex After 50, How to Maintain or Regain a Spicy, Satisfying Sex Life. Joan, welcome to Wellness for the Real World.
Well, thank you. Thank you. I love what you said.
I like when I give the promos and people are coming on and they're chuckling because I said something that made you chuckle. So what about what I said made you chuckle, Joan?
Well, I love that you are seeing aging as a celebration of your sexuality instead of, things change. You got to admit it. Things change. If they haven't for you yet, they will. But that doesn't mean that sex is over. It just means it opens up a whole new opportunity for exploration to figure out what works for us now. And that might be different from what worked for us at 25. Although I got to say, we've got it over the 25-year-olds. With apologies to the 25-year-olds, it's going to take some years, some decades of experience before you really know yourself sexually.
Yeah,
and
you
know
start
what you have
to
to give to a partner or to yourself, because sex isn't just partner sex. So, there's so many directions I'm going. Reel me in.
Yes. But I think with sex, you have to be comfortable with yourself and with your body. And so if you haven't gotten comfortable with your own body, sex ain't going to be all that great. And so if you're one of those kind of people that, I'm all tightened in and I can't show anything, and sex is not going to be all that fabulous. You have to know who you are. And I feel for most people, and it seems for most people, that as they mature, as they get older, and especially after you pass out of the performance era, which I would say is your 20s, that sex does take on a whole new life of itself and is fun to explore at a particular point. So tell me, what are some of the biggest misconceptions about senior sex? Because we're talking about, not just are we talking about sex over 25, we're talking about sex over 65 or 67 or whatever we want to call a senior. What are some of the misconceptions?
There is a major misconception of society, and there's a major misconception that my generation has too. So the society's misconception is that only youthful appearance is desirable. So and that obviously if somebody is wrinkly and maybe has a few more sags and bags that she or he can't be sexy. Untrue. Sexuality is lifelong, and we are as juicy as we feel. What the misconception that my generation, I'm speaking as a 72-year-old, that we have ourselves is that if the old ways don't work the way they used to, that sex is dying on us. And that's not true either. That's just a new challenge. We face challenges with aging all along. We face medical challenges. We face relationship challenges. We face financial challenges. It's a life of challenges. It isn't what happens to us, it's what we make of it.
Let's talk about the physical appearance, because our society is so into the physical appearance of youth. What have you found about how people, and I feel like I remember that you actually posed nude someplace as a senior citizen.
Not nude in lingerie.
Ah, okay, but that still is stunning.
I've been invited to pose nude. I've said no to that.
Oh, I think you ought to do it. We have to get into it. Bodies are beautiful, and for me, as a physician, you can see somebody who they look fine and they are so unhealthy on the inside of their body. And so I've come to appreciate all types of body that represent health. And that doesn't just mean somebody who is a size 0, and 20. That's just not what health is. It's so much broader than that. But tell us about what you found people feel about your physical appearance, or the physical appearance of women, especially as they move on in years. Do you find people are repulsed or people are interested? What's going on out there?
Potential partners are turned on. Now, we are the ones that are repulsed by our own imagination of what someone else might be thinking. And that's something we just have to deal with psychologically. Because as you said, all bodies are beautiful. Our bodies are desirable if there's someone who wants us. If there's someone who is interested in us, he's not going to say, oh, gee, I thought you'd look better with your clothes off. Not at all. He'd be thinking, oh, my God, I get to see her naked. So instead of thinking he's going to notice the folds in my neck, I mean, who looks at that? But people stress about that. Or he's going to notice that I have an abdominal scar, or I'm going to have to reach for the lube before he even touches me. We can just say, hey, this is the body I'm living in. It is capable of giving me great pleasure. It's capable of giving a partner great pleasure. So let's just rejoice that we can do this.
So, Russell, jump in and tell us your experience as a gay man and sex in not at 25, but a little bit older than 25.
Well, actually, it's funny. You were just, hi, Joan. You were just talking about, these things we hate about our bodies. And I was just having this conversation with a friend of mine just recently. We're all upset about, I have a gut, or, oh, my God, I have wrinkles, or whatever. And he just sort of waved his hand at me, and he said, I'm sort of over worrying about stuff like that, because whatever you think your problem is, there's somebody out there that's really into it.
I love that.
Yeah.
Oh, I love that so much.
and also, I just would like to ask you. You describe yourself as an advocate for ageless sexuality.
Yes.
Which I think is great. If I were to work with you, could you issue me a certificate that would say something like that?
A master's in ageless sexuality?
I'm thinking I'd like to frame it and hang it over my bed.
That sounds like a great idea. I could go into that business. Certificate for ageless sexuality has passed the course. Maybe then no one will notice the teeth in a glass by my bathroom sink. That's what I'm thinking. What do you think the exam would be for that one, though?
Oh, no.
Well, maybe we need another segment for that.
Let's think about that.
Yeah,
I do love
maybe
your voice,
Pictionary.
though. Dr. Veronica was right. Your voice is amazing.
So one piece that I must mention, I always have to put on my medical hat that has been going on, though, is in the senior community and even in nursing homes, the rate of sexually transmitted diseases has been increasing. And so in the youthful population, safe sex has been talked about so much that there's not just these big upticks in sexually transmitted disease, whereas in the senior population, there have been large upticks in sexually transmitted diseases. Can you comment on that?
Oh, yeah, I'll comment on that. You'll have to stop me when you want me to be done, because this is one of my soapboxes. I have a whole chapter on this in the Ultimate Guide to Sex After 50. So many problems. So many problems. One is that that if we can't get pregnant, we must not need barrier protection. That's a stupid illusion we have. The other problem is that the doctors don't even think to ask us, are you sexually active? Most of the time, because they assume we're not, because they're the age of our grandchildren, and they're not going to ask us a question like that. They would consider it invasive, or maybe it wouldn't even occur to them. And so we think and then we look at someone who's just lost his wife, and we think, well, he's been in a long-term relationship for 30 years. Obviously, there's nothing to worry about here. Come on.
That's when it's going to uptick. He's going to go bananas. He's going to go crazy. His wife just died. Are you kidding? These men, their wife just dies, and in a minute they're in another relationship.
Well,
men especially.
Might not be a minute, but that's the thing. It might have been 3 years, and we don't know what he's been doing in those 3 years, or in the last 6 months, or the last 6 weeks. Here's the advice: use barrier protection. That is condoms, dental dams, whatever it is you need, gloves even sometimes, with every relationship until such time as you are in a committed exclusive relationship and have been in that relationship for 3 to 6 months. And the reason for the time lag is if somebody is waving this piece of paper that says, hey, I have no sexually transmitted infections, look, I just got tested last month. Well, that will tell you where you were maybe 6 months before that. It won't tell you where you are today.
This is just wonderful because people think life is going to end after if their spouse dies or they get divorced, especially when they're older. And so it's wonderful to think. I mean, intimacy is so important. The physical touch, even when it's not sexual, touch that is not sexual, but in a intimate way is so important. Why? Because it releases hormones, the hormones that make you feel good and keep you alive. And so make sure that you get enough hugs. We're in a society today where sexual harassment. And there are people who are dirty and they just need to check themselves, and people need to take some martial arts so you can drop kick those people. But on the other side, we've gotten so into where we're scared to touch each other. And when it comes to sexuality, some people, it's so prudish that you're only supposed to have sex under certain circumstances. And that means that either you're very young and then you can go crazy, or you're married. And so if you're married, you're allowed to have sex. And most people are not doing it under those circumstances. That's so right. Here we are. We're talking about senior sex. Tell us about some of the physical challenges that seniors face. What do they have to worry about? We know about ED and erectile dysfunction because we got all the commercials with people strolling along. And even the people strolling along in the commercials don't seem like they're necessarily old enough to need those medicines. They should put some older people on there. Maybe
at the best 40 there.
Yeah. So what are the challenges physically?
Well, the challenges, and I want to make a distinction between what Michael Castleman, who's a sex educator, has called erectile dissatisfaction versus erectile dysfunction. Erectile dysfunction is where the penis does not get erect at all anymore. Not in the morning, not through masturbation, not at all. Whereas erectile dissatisfaction, which is really what most men who say they have ED are actually facing, is they can sometimes get erections, but maybe not dependably, maybe not enough for penetration of a partner, and maybe they can't maintain it, even if it does work at first. So then when they have anxiety about that, it just exacerbates the problem. So for male bodies, that's the main thing, is the combination of not getting dependable erections and being anxious about that. For female bodies, it's certainly lack of lubrication, fragility of the vaginal tissues. So we just incorporate lubricants into our sex play right from the beginning, make it sexy, just as we would make condoms sexy, going back to that. If we eroticize these needs, then it just becomes part of the love play. It's just part of the sex play.
I got to jump in because I'm like thinking back, Al's looking at me smiling and saying, why is she over there smiling? And I had this boyfriend who he had not the strongest erection in the world. And I'm just sitting here thinking, oh my God, but everything else was so fabulous. Oh my God, he like made up for what that wasn't doing. He made up for it. It's almost to me like when men can't use that, all of a sudden they get creative. And as a woman, it's like the bomb. Oh my God. So just having said that, I'll calm back down now. And anybody who got offended by that, switch off Wellness for the Real World, because you're going to hear that all the time. But anyway, I just got to say
too, because I absolutely agree with that. That's the thing. If we just take the focus off this one part of the body that might not be up to the job that they want, instead, let's get creative. You've got 10 fingers, you've got a tongue, you've got arms to hug with, you've got vibrators. We will be talking about vibrators, won't we?
I got to have Russell jump in and give us the man view on what we just said about this. So Russell, tell us. I'm just saying, oh my gosh. I mean, it's funny because, we're all adults here, so we've had some experience behind us. And just as she was talking about physical challenges, I was like, he may have thought it was a physical challenge, but I was not thinking it was a physical challenge at all. So comment, Russell, please.
All right. Calmly, I'll say. Well, speaking of ED, whether that's for dysfunction or dissatisfaction, and just as a caveat, I want you to know I've never experienced that myself. I am, in fact, the dude they make Viagra from. However,
I wondered who that dude was.
Yeah, well, you met him. One thing
you get your certificate right now.
It's easy to say, oh, we shouldn't focus on that. But I can tell you for a man, taking something like that is not just about your erection. It takes, even if you don't use that erection, so to speak, it takes an enormous pressure off your shoulders because you're afraid you're going to disappoint your partner. And it frees you from that, which is wonderfully freeing and opens you up to all kinds of creativity because you feel you don't have to make that particular mark.
Well, I think that's very valid. It takes the anxiety away.
Yeah.
But when it's not there, I think from a female perspective, we're not all that. We deal with all kinds of circumstances, especially when we're into the person. You deal with whatever circumstances is presented to you. And, I have one of my friends saying, I can wake the dead. I can wake the dead. We get, creative, and we're going to deal with, when we're into that person, whatever presents itself or doesn't present itself, and make the situation wonderful. And so what do you have to say about that, Joan?
It's not all about penetration. Let's be blunt about that. It's about sensation. So if we say, okay, the biggest sex organ we have is the skin, and that doesn't mean just the penis skin, and it doesn't just mean the vaginal skin. We have lots of skin, and if we concentrate on giving pleasurable sensation to our partners, using all of our faculties, using our hands, using our mouths, using our words, we can, and I think this is what you were talking about, Dr. Veronica, that if the erection is not the major focus, that the partner gets creative. How can I please you whether or not this erection is going to happen? And it's fine. Many of us like penetration, but it isn't the only thing. It isn't the only thing we like. And most women do not reach orgasm through penetration.
This is true.
Yeah.
Changing sexual needs. Sexual needs change over time. I think especially even more in women. How do you talk to your partner about those changing sexual needs? And I think the talking is more of an issue in people who are in long-term relationships. I think people in new relationships communicate a little more, especially women. You're just like, I'm going to get what I need and I'm going to talk to you. But when you're in a long-term relationship and your sexual needs or desires are changing, how do you approach that?
Well, one way you don't approach it is by saying, oh, God, I just hate sex with you these days. You don't approach it that way. You approach it.
No, that doesn't work.
I know, that doesn't work. Have you tried that? You know that doesn't work.
No, but I received it.
Oh, my God.
Oh, my gosh. Oh, that's just horrible. So what I tell people to do, and I have a whole chapter on this in both Naked at Our Age and in the Ultimate Guide to Sex After 50, about how you have that conversation. You have that conversation not when you're naked in bed, but at a neutral time in a neutral place. And you say something like, I love you. I have always loved sex with you. Do you know what? My body is changing with aging. And some of the ways I like to feel sensation are a little different than they used to be. And I wonder if we could go on a journey of exploration to figure out some new things that might turn me on. Couldn't you hear that from a partner? I hear that from a partner.
I was thinking in the Dr. Veronica terms of how I would say that.
How would you say it?
I don't necessarily know how I would say it, but it wouldn't be, can we go on a journey of exploration? You guys know what we mean when we're saying that, so you're going to have to put that into your own words so it sounds. If you say, can I go on a journey of exploration? I'm just kidding with you, Joan, over there.
No, that's all right. My whole point with that is to make it yours, to figure out your words that would fit with that, not so you go, yeah, what have you been reading? I want to tell you an example of when someone doesn't do this. I have a blog, nakedatourage.com. It's been running for about 11 years.
Award-winning. It's an award-winning blog, Naked at Our Age.
Yeah. And we just talk about senior sex, news, views, and sex toy reviews. Well, I had a comment from a reader who said, my wife has, he said, I am 80 or something like that. I've been married to my wife for, I don't know, let's
60
say
years.
60 years. He says, she has always liked having her breast caressed. But now, no matter how long I do it, she doesn't get aroused. What do I do? About the same time, I got an email from a woman who said, I always used to be stimulated by having my breasts touched, but now it just irritates the hell out of me. My husband won't stop mauling my breasts. What do I do? I can't tell him because I don't want to hurt his feelings. Now, I don't know for sure that was the same couple, but it might have been. And the problem was the big C word, communication. She doesn't want to hurt his feelings, so she doesn't say, I don't like that anymore. He is doing what he's always done to please her, and it doesn't work, and they're in an impasse. And if she just said, honey, I know my breasts used to be I used to love having my breasts touched, but now my body's changing, and that doesn't work for me anymore. Let's figure out what does. Here's how I'd like to be touched now. If she doesn't tell him, he'll never know. He's not going to suddenly mind read, oh, you know what? I don't think she likes this anymore because she hasn't told him.
Yes. Well, Joan, this has been quite delightful. We're coming up on the end of our show on Wellness for the Real World, and we always have exciting conversation here. You're listening. This is Joan Price, and go to her award-winning blog, nakedatourage.com, nakedatourage.com, or you can go to her website, Joan Price, just exactly, nothing complicated about it, joanprice.com. Her book is The Ultimate Guide to Sex After 50. How to maintain or regain a spicy, satisfying sex life. And I want to thank Joan for being on the show. Russell, it's always a pleasure to speak with you. If you guys haven't figured out, we're all broadcasting from different locations. So Russell is on a different site than I am. But we've been partners for so long. Not those kind of partners, but partners for a while. This is Dr. Veronica. This is Wellness for the Real World.
Thank you for listening to the Wellness Revolution podcast. If you want to hear more on how to bring wellness into your life, visit drveronica.com. See you all next week. Take care.